Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great video for those of you with back pain of multiple sources, including spondylolisthesis, degenerative discs, retrolisthesis, herniated discs, and bulging discs. We're going to be talking about a top rehabilitative exercise for the multifidus muscle, multi-angle multifidus training. Hope you enjoy.
So one of the key exercises I'm always working on with patients with lower back pain, regardless of whether their diagnosis is spondylolisthesis, retrolisthesis, degenerative discs, herniated bulging discs, almost all cases of lower back pain, patients commonly have weak or atrophied multifidus muscles. Now remember, the multifidus is a small muscle that comes off each vertebra. If you go to your lower back and feel the bones, the center knobs right in the middle of your back, if you go to the lower corners of right and left sides of each knob, you will feel the multifidus muscle. Easy way to check whether your multifidus is functioning correctly or not is, number one, to feel if there is a gap or a depression on one side of the spine versus another, indicating an atrophied or shrunken multifidus, which is very common with many cases of lower back pain, including disc problems. Or if you have an inhibited multifidus, meaning that when you contract your multifidus, such as when you lean slightly forward from the waist, have your whole pelvis roll forward from the hip joint, usually that multifidus muscle is going to contract. And you can check those levels right and left to see if one side is not contracting as much as another. Make sure your thumb is right up against the side of the spinous process, which is that knob in your lower back. You're going to be at the very lower left and then lower right corners. You could use both thumbs to check and compare both sides at two levels, and as you lean forward, you're going to notice if one side doesn't contract as much as another. And you can also check co-contraction when you pull your lower tummy inwards towards your spine using your transverse abdominis. Your multifidus should contract. So if you notice that when you pull your lower stomach in below your belly button, you don't feel as much contraction on one side as another, you have indeed a inhibited multifidus muscle, which is a key component of lower back pain because the multifidus, as it contracts, helps to stabilize, helps to hold your spine in a good position. Many problems with bending forward with disc problems are going to be aggravated because the multifidus can't check the vertebra and hold it in place, and as a result, the vertebra starts to bend forward, compressing the disc. Cases of spondylolisthesis, retrolisthesis need stability. The best way to stabilize a sliding vertebra, whether it's slid forward like in spondylo or backward in retro, is to compress the vertebra. And multifidus muscles, because of their line of drive, their action as their attachments, when they contract, they compress the vertebra and help hold it so it doesn't slip back and forth when you're doing exercise, when you're doing activities. So training multifidus is key. Once you've learned how to increase the bulge of the multifidus, and again, there's different techniques that I've shared on this channel having to do with waking up the multifidus, to hold it in place as you move in multi-directions is a key way to train it to stay put and to stabilize your spine when you're involved with sports and daily activities. So today we're just going to use a very simple way to increase the multifidus, which is when we bring the lower abdomen in, we're going to focus on that pressure of the lower abdomen going back to that spot where the multifidus is weak. And the more you focus mentally on that, you're going to use your nervous system to help increase the contractibility or the tension in that multifidus muscle. Once you feel that start to harden more from its weak spot, you're then going to maintain that as you move your body in different directions. Now, what's important to realize about multifidus is that as you tilt a little forward from your waist, again, you can either use your lower back to bend a little forward or preferably tilt the pelvis around the hip joint when you first do this. You're going to try to maintain that contraction on that multifidus muscle. If it's weak, you're going to try to limit your range of motion so you're not going as far and you can still hold that contraction. It's important to hold it both on the way forward and on the way upwards. Many times people will have it contract easily as you go forward because body weight is bringing you forward. The multifidus naturally likes to contract because it's trying to resist your body falling forward and resist it with an extension force. But coming back up from the forward position, that multifidus contraction is going to be lost and you'll feel it decrease its tension under your thumb or your finger that's holding onto it to monitor it. The other thing that you can do is you can use motion side to side, and you're going to try to maintain that multifidus. Again, use a range of motion that you can train it in, and if you notice it starts to get weaker in that direction, that's where you have to focus that lower abdomen pressure in, bulging out, so you can practice increasing that tension. The toughest positions are going to be in extension and coming to the side. The multifidus can use other muscles to help it, such as the erector spinae muscles, the lats, other muscles that help to bring us backwards. However, if we go backwards and start to feel that multifidus relaxing, it's because the multifidus is taking a break. It's not being a dominant stabilizer muscle. It's relying more, for instance, on the erector spinae muscles, which are about an inch out from your spine, to contract. So you want to make sure that you can maintain that multifidus as you go backwards, rolling from the hips, forwards, side to side, and especially the toughest one of all will be obliquely, moving 45 degrees. As you go 45 degrees away from the side where it's weak, it'll be easy to hold it, but as you go 45 degrees back, you'll notice, it wants to relax. Got to maintain that tension of the lower abdomen in, bulging out, or any other techniques that you've found to help train multifidus muscles. After a while, you can use your hips to move in figure eights, circle patterns, all kinds of patterns, and look for where that multifidus is weakening. That's where you got to slow down the motion, focus on maintaining it, and as you get better at it, you can increase the range of motion, or how far you move, maintaining that multifidus contraction. Key component to stabilizing the spine, as I said, decreasing the instability and many times the injury with degenerative discs, herniated discs, bulging discs, retrolisthesis, and spondylolisthesis. If you like this video on multifidus training, check out our channel, subscribe to it. We've got a lot of great videos out there to help you. If you're interested in leaving a comment or have a question, feel free to write in. I'll do my best to answer them, as I always do. And remember, if you're looking for a great program to analyze your body mechanics, figure out what's going on with your spine, why are you mechanically still stressing your spine, what's preventing you from getting back in the gym and working out heavy, check out our fast track programs. We have a fast track program for spondylolisthesis, a fast track program for degenerative disc disease, which would be applicable for herniated and bulging discs as well. And we have a brand new fast track program that's out on retrolisthesis, all designed to guide you through an analysis of your body, your mechanics, your spinal stability issues, how to correct them, and then how to customize a program for yourself to help build your stability strength and help prevent chronic lower back pain. I hope this video on multi-angle multifidus training helps you with your chronic lower back pain.